My name's Ashley Wilson, and I graduated from Farmingdale actually it was 2 years ago in 2011. I have my associate's degree and I'm pursuing my bachelor's, and this is one of my clinical classes that I had to do a presentation. I had to assess the needs of the community and basically formulate a learning teaching plan so that these patients would reduce the vulnerability within the community to promote their health. So I did my clinical in Dolan Wellness Center, which is through the North Shore system. I did it at, it's in Huntington. And a lot of the patients there are Hispanic patients. They come right from Spanish-speaking countries, but the problem with them is that they don't have much health insurance. Their finances are very limited, and so is their health literacy. So the problem with them is actually getting them into the facility because they get nervous for many reasons. And one of the main reasons is that they get nervous because they're going to be, they think that we're going to turn them into the government actually, and they're going to be deported back to their country. So for this project, I focused on RSV because this is the season of RSV. Actually, it's a leading cause of pneumonia and bronchiolitis in high-risk patients. And so I'll give you a little background. Okay. So one of the problems is that 2 out of 3 Hispanic parents don't even know what RSV is. And also 1 out of 5 Hispanic parents don't know what RSV is until their baby is actually contracted with the disease. The risk of prematurity in Hispanic infants is 11.5% in the Hispanic population. And outbreaks occur in communities each year, resulting in many hospitalizations of patients. So what I focus on, instead of focusing on the whole entire Hispanic community, because it's difficult, there was a lot of patients, I focus on high-risk infants who are at risk for RSV. And these patients are those who are premature, born less than 35 weeks of gestation, and also patients who had chronic lung disease, bronchial pulmonary dysplasia, and CHD, which is congenital heart disease. So the purpose is my whole learning plan was to identify the parents' actual perceptions of RSV in relation to their baby's risk. Because sometimes when you do risk assessment, you basically focus on the patient, but it's hard because these patients are pediatric patients and you can't really speak to a premature infant. So the background for the Hispanic patients is that they come into the health center with limited literacy, insurance, and finances with little knowledge of how this will affect their health. So to prevent preventative efforts against RSV within the community, we correlated Pender's health promotion model with these needs. So her model focuses on the idea of disease prevention, kind of correlates it with cultural characteristics, behavioral influences, perceived benefits of seeking care, and also the barriers to health care. So the ones that I kind of focused on were the prematurity rates, the cases of RSV within the Hispanic population, and the conditions of the actual homes of Hispanic patients, which turns out to be, they live in, mostly, a lot of patients live in homes with many, I guess with many individuals, because they just come and they really don't have many finances to support themselves on their own. So they live with multi-generational families. The perceived benefits of seeking care are determined on their education and how they perceive the way that they will be treated and how their outcomes, their final outcomes. And the barriers to seeking care we found out were finance, language, and knowledge. So over the semester, I met with 2 nurses who actually helped me roll out this program. It was called You and Me Against RSV. And we gathered and compared information from the Synergist prophylactic program, which is, Synergist is a prophylactic treatment that you give pediatric patients, high-risk infants. It's a series of injections. It's once a month, and it helps produce antibodies against the RSV disease. And it kind of acts as, I guess, like a barrier to contracting the disease. So we looked at that from last year, and we compared it to when we rolled it out this year. And we also, to determine their healthcare needs, we gave them a survey each 2 weeks that measured their the way that they perceive the risk factors and the transmission and preventable factors. We also reviewed data on the high-risk infants for hospitalization. So what we found, this is just, it shows the curve. So RSV peaks in the winter months from fall to actually early spring, so from like October to April-ish. So you see that it peaks really high here in November and December, and kind of drops in the summer months. So this is it climbing back again. So we have to do something so these patients don't get admitted to the hospital. So we found that the lack of parental knowledge for community prevention strategies, which are here, like hand washing, avoiding crowds, disinfecting hard surfaces, covering mouth when coughing or sneezing, avoiding contact with sick individuals, and the synergist prophylactic. So you see the blue right here is very important. So we ranked on very important, somewhat important, and not important. And this is how it turns out. So you see that there's a lot of patients, well, a lot of parents don't really know prophylactic strategies that they could take to prevent RSV. This one here is the synergist prophylactic program from last year. There was 11 individuals last year for high-risk infants. Like I said, these patients with prematurity, CLD, CHD. And we saw that there was an 81.7% compliance with the synergist prophylactic. So that's each month. So overall, it's not too great. 2 out of 11 high-risk infants also were hospitalized for the disease. So that's big because they're dependent on oxygen, dependent on fluids, and it could cause mortality. They could get chronic asthma. They could develop into serious respiratory issues. Also, this shows the antigen detection testing, which wasn't offered at Dolan Health Center because it gets expensive and these patients are being covered. And also, the Synergist vaccine costs about $1,000 a vaccine. Okay, so the implications that we found after assessing these statistics were that we need to raise awareness of the prevalence, transmission, and preventable factors for parents of babies with high risk for RSV. I placed awareness on the living arrangements because they come in from crowded living arrangements. A lot of parents put their babies in daycare, which is also risk for RSV. There was also a need to standardize methods of ongoing education for these parents to make sure that they fully understand the benefits of seeking care and the strategies that they could take on their own to prevent RSV. And there was concern because this is unsatisfactory. You got to get it to 100%. 81.7% is just not enough. So throughout this semester, kind of ended early. I only had like 2 months to get it done, but the Synergist vaccine goes through April. So I measured from October and November, because they started early, vaccinating the patients for high risk. They started in October, actually. So through September, October, and November, we identified the parents of patients of high-risk infants by looking at the data of the prematurity rates for the infants, and we called them. They made appointments. They would schedule. I went every Friday, so they would schedule them kind of when I was there. So we could educate the parents bi-weekly on the health assessment, and during health assessment meetings that emphasize public health, ways to prevent RSV in the community, and environmental modifications that they can make on their own. And also, hand hygiene is the #1 preventable strategy that a parent could take, well, anyone could take, even us as nurses. So we held hand hygiene demonstrations for them during their October meeting. And they demonstrated back to us, and we knew, I guess, that they learned a little bit from that. So the outcomes after this whole learning process over the semester was that 100% compliance with October and November Synergist vaccines of 6 patients. There was 6 identified high-risk infants. There was also an increase in identification of the importance of preventable strategies, which is shown here. No one thought nothing was not important anymore. There were some that fell off, like avoiding contact with sick individuals, because sometimes they really can't. Their house is so crowded that it's really difficult. So we just have to make sure that everybody washes their hands because RSV is transmitted by droplet transmission. And so lastly, we're trying to find out things for the future, how we could promote healthcare and continuously promote it within this community. So I found that, like, maybe if identifying these patients through antigen testing, maybe like once in September, and seeing if it rises. I mean, I don't know because when they contract it, it's kind of difficult to keep testing them like that. So maybe we could test them at least once and see if there's something that we could do to be prophylactic. I would also like to educate everybody, all these parents of pediatric patients, because it's difficult just focusing on one group when someone could sneeze and not wash their hands and somebody else could get the same thing. And these droplets live on hands for a half an hour, and they can live on surfaces for 5 hours. So it's really important to disinfect and wash your hands. And lastly, I would like to use interdisciplinary team planning, so we could get like insurance companies to help them and the social worker and kind of help them get to places, because the reasons why they fell off here were because some of them couldn't even make it to the place. They had insurance issues, and it was just difficult for them to actually find the time to make it, let alone they really didn't know. So that's it really, but this is what I did throughout the semester, and this is it. Does anyone have any questions? No? Okay. Thank you guys.
Thanks, Ashley.
Thank you.
Nice to have you.